Yeah, so I'm going to be presenting this year on a panel as part of a three-person panel about digital therapeutics. So digital therapeutics are really technology-based healthcare therapeutic interventions that are used either in conjunction with or on their own to treat certain disease states. So they're increasingly becoming an important part of how we manage diseases. Yeah, so again, I'd say more and more patients are turning to apps in their phones to supplement how they're treating certain disease states. So the panel actually includes representatives from various stakeholders within the industry that are have a vested interest or a stake in the success of digital therapeutics. So we will have a representative from the actual digital therapeutic industry, someone from the PBM industry, and then I'll be representing the payer industry. So what I'm there to speak to is, what is the payer's perspective on coverage of these digital therapeutics, given the fact that, there are some issues we see with them, such as, I run the pharmacy benefit for Highmark, and so we're used to very robust and structured clinical data and studies. And the studies that we see around digital therapeutics are not similar to what we're used to seeing. So that's, I'm going to bring that payer's perspective of, how do we think about coverage? So yeah, Highmark is one of the payers that is covering certain prescription digital therapeutics. We do have a medical policy that guides our coverage decisions, and really looking at the outcomes that we see. Now we're still collecting those outcomes, so I think the long-term coverage of that is, still to be decided. But we're really looking at, some of the things that you don't think about when you're thinking about the management of diseases. So, for example, is it used in combination with a drug or another treatment option, or is the digital therapeutic the treatment in and of itself? And then something else that you really don't have to think about as much when you're thinking about other types of drug treatments or other types of treatments is data privacy of a member's data. So if patients are out there downloading apps and engaging with therapeutics in a digital way, we have to be really careful that we are also at the same time protecting their health data. Yeah, any sort of legislation is important when we think about how we're going to cover treatment options. I mean, again, this legislation is becoming increasingly important in a lot of spaces, again, including drug therapy, which is, where I lead within Highmark. But, if legislation encourages or requires the coverage of digital therapeutics, then that's another space that we'll be able to learn from. And then we think about, how the outcomes that we see and how we can structure that coverage in the future. And of course, sometimes we can make decisions differently for our insured population versus our self-funded business. Our self-funded employer groups can also guide how they want to cover certain therapeutics. And so we'll take that into consideration as well. I think, I think digital therapeutics are an exciting new option, and we're only going to see more of it. And I think what's really exciting about it is that it can be used to supplement existing therapies and to help them work better. There's things that deal with the behavioral health aspects of certain disease states, or drug compliance and that, or side effect management related to drug to treatments. So I think that's, it's exciting that it can be a treatment by itself, but I think increasingly more important or exciting is just making current treatments even better.